Welcome back to our Iron Deficiency Anemia series. In part 1 of this series, we talked about what is iron deficiency anemia, its symptoms and why these symptoms occur. In this video we will go deeper into the treatment and explore practical steps that you can take at home to address iron deficiency anemia. Before we get into it, don't forget to like and subscribe for more medical tips and advice. Alright, let's dive in. Diet modification is the first step to increasing iron. Increase intake of iron-rich foods in your daily diet. Include lean red meat, poultry, fish, dark leafy green vegetables such as spinach and kale, legumes such as beans or lentils, fortified cereals, and dried fruits. In order to enhance the absorption of iron, consume foods rich in vitamin C, such as citrus fruits, strawberries, tomatoes, or bell peppers. Here's a cooking tip to help enhance iron absorption. Cook plant-based iron sources such as legumes or spinach with vitamin C containing foods. Important note: avoid drinking tea or coffee with meals, as they can inhibit iron absorption. Instead, consider having them between meals. If dietary changes alone are not sufficient, iron supplementation may be prescribed. Over-the-counter supplements should be taken following the recommended dosage on the product label. Take iron supplements on an empty stomach or with vitamin C-rich foods for better absorption, unless instructed otherwise by your healthcare professional. Tips for proper supplement administration to maximize absorption and minimize side effects. Take iron supplements with water or juice. Avoid calcium-rich beverages like milk. Avoid taking iron supplements with foods that can interfere with absorption, such as dairy products, antacids, or high-fiber foods. Space out iron supplementation from other medications or supplements by at least 2 hours, as they can interfere with each other's absorption. Menstrual health management. If heavy menstrual bleeding contributes to your iron deficiency anemia, consider speaking with your healthcare professional about the causes and appropriate management options, such as hormonal contraceptives. Schedule regular checkups to monitor iron levels regularly, and communicate with your doctor regarding any symptom changes or concerns. Follow-up blood tests to assess hemoglobin and iron levels may be requested. While at-home treatment can be effective for mild cases, it's crucial to consult with a healthcare professional for a proper diagnosis and guidance based on the severity of your condition. And there you have it, effective at-home treatments for iron deficiency anemia. This concludes our Iron Deficiency Anemia series. Thanks for watching.